1 month before stroke, your body will show warning signs that something is wrong. Be aware of these signs so that you can take action to prevent the stroke from happening. Here are 8 warning signs of a stroke 1 month before it happens. Hello and welcome back to the channel. We are so glad you are here today. If you are new to our channel, subscribe so you never miss out on health tips that help you live better. The topic for today is about 8 warning signs of a stroke 1 month before. Plus, we have prepared 9 powerful tips to prevent a stroke. A stroke occurs when the blood flow to the brain is interrupted, either by a blockage or the rupture of a blood vessel. When this happens, part of the brain doesn't get enough oxygen and nutrients, which can cause brain cells to die. Before we discuss the warning signs, let's talk about the risk factors associated with strokes. Risk factors are characteristics or conditions that increase your likelihood of developing a stroke. Understanding your risk factors can help you take proactive measures to lower your risk. Some common risk factors include high blood pressure, diabetes, high cholesterol, smoking, obesity, and heavy alcohol consumption. Other risk factors include a history of stroke or transient ischemic attack, TIA, atrial fibrillation, a condition that affects the heart's normal rhythm, and carotid artery disease, where the arteries in the neck that supply blood to the brain become narrowed or blocked. Age is also a significant risk factor, with the risk of stroke increasing after the age of 55. However, it's important to note that risk factors do not guarantee that you will have a stroke, and many people who have risk factors never experience one. Conversely, some people without any known risk factors can still have a stroke. Now that you know your risk factors, let's discuss the warning signs of a stroke. Recognizing these signs is crucial for seeking timely medical attention and potentially preventing or reducing the severity of a stroke. No. 1. Sudden weakness, numbness, or dizziness. One of the most common warning signs of a stroke is a sudden weakness, numbness, or dizziness that occurs on one side of the body. This can manifest as a loss of balance, difficulty walking or speaking, or a drooping or swelling on one side of the face. It's essential to pay attention to these symptoms, even if they are mild, as they could indicate an imminent stroke. 2. Sudden severe headache. A sudden, severe headache that comes on without any apparent cause can be a warning sign of an impending stroke. This type of headache is often described as the worst headache of my life and may occur due to the rupture of a blood vessel in the brain. If you experience a sudden, severe headache, seek medical attention immediately, as it could be a sign of a stroke or another serious neurological condition. 3. Problems with vision. Changes in vision, such as blurred or double vision in one or both eyes, can be a warning sign of an impending stroke, particularly if accompanied by other neurological symptoms. These visual disturbances may result from impaired blood flow to the occipital cortex, the part of the brain responsible for processing visual input. 4. Sudden confusion. Difficulty speaking or understanding speech. If you or someone you're with suddenly becomes confused, has trouble speaking or understanding speech, it could be a sign of a stroke affecting the areas of the brain responsible for language and cognitive function. This symptom often occurs with other neurological signs, and it's crucial to seek immediate medical attention if you notice these changes. 5. Difficulty walking, loss of balance, or coordination. A sudden difficulty walking, loss of balance, or coordination could indicate an impending stroke, especially if it happens without any recent change in medication or illness. These symptoms may result from issues with the cerebellum, the part of the brain that coordinates movement and balance. 6. Fatigue, nausea, and vomiting. While fatigue, nausea, and vomiting can be symptoms of various conditions, they can also be warning signs of a stroke, particularly when they occur suddenly and are accompanied by other neurological symptoms. These symptoms may indicate increased intracranial pressure due to bleeding or swelling in the brain. 7. Sudden severe tearing pain in the chest. A sudden, severe tearing pain in the chest, often described as the worst pain I've ever had, may be a warning sign of an aortic aneurysm rupture, which is a life-threatening condition that requires urgent medical attention. While less common than other stroke warning signs, it's essential to be aware of this symptom, especially in individuals at risk for aneurysms. 8. Changes in urination or incontinence. A sudden change in urination, such as increased frequency or incontinence, can be a warning sign of a stroke, particularly in older adults. This symptom may result from damage to the areas of the brain that control bladder function. Now that you're familiar with the warning signs, let's discuss how to prevent a stroke. While not all risk factors are modifiable, several strategies can significantly reduce your risk. Number 1, control high blood pressure. High blood pressure is a leading cause of stroke, so it's crucial to keep it under control. This can be achieved by making lifestyle changes such as eating a balanced diet, reducing salt intake, engaging in regular physical activity, and getting enough sleep. In some cases, medication may also be necessary to manage blood pressure effectively. 2, maintain a healthy diet. Eating a healthy diet is essential for stroke prevention. Focus on consuming plenty of fruits, vegetables, whole grains, and lean protein sources while limiting saturated and trans fats, cholesterol, and added sugars. A Mediterranean diet, which emphasizes fruits, vegetables, whole grains, and healthy fats, has been shown to reduce stroke risk. 3, regular exercise. Engaging in regular physical activity is key to reducing stroke risk. Aim for at least 150 minutes of moderate intensity aerobic exercise or 75 minutes of vigorous intensity aerobic exercise per week, along with muscle strengthening exercises targeting all major muscle groups, 2 or more days per week. 4, quit smoking and limit alcohol. Smoking increases the risk of stroke significantly, so quitting is crucial for stroke prevention. Additionally, limit alcohol consumption to reduce the risk of high blood pressure and other stroke risk factors. 5, manage diabetes. If you have diabetes, it's vital to manage your blood sugar levels effectively. This can help prevent complications like high blood pressure and high cholesterol, which contribute to stroke risk. Work with your healthcare team to maintain healthy glucose levels through a combination of diet, exercise, and medication if needed. 6, monitor cholesterol levels. High cholesterol levels can contribute to plaque buildup in the arteries, increasing stroke risk. Get your cholesterol levels checked regularly and work with your healthcare provider to develop a plan for managing your cholesterol, which may include lifestyle changes or medication. 7, get enough sleep. Aim for 7 to 8 hours of quality sleep each night to help maintain healthy blood pressure, manage stress, and support overall cardiovascular health. Establish a regular sleep schedule and practice good sleep hygiene to ensure a restful night's sleep. 8, stay socially active. Social isolation and loneliness have been associated with an increased risk of stroke. Make an effort to stay connected with friends and family, participate in community activities, and seek support when needed. 9, regular checkups and screenings. Schedule regular checkups with your doctor and follow recommended screenings and tests. This can help identify and manage risk factors early, allowing for timely interventions to prevent stroke. Be sure to discuss any concerns or questions you have with your healthcare provider. While stroke can be a serious and life-altering event, it's important to remember that many strokes are preventable. By being aware of the warning signs and taking proactive steps to manage risk factors, you can significantly reduce your chances of experiencing a stroke. Remember, knowledge is power, and taking control of your health is the best way to ensure a brighter future for yourself and your loved ones.